All right, fam. Listen, back again, checking in. Put some light on me because got my handy dandy turban on, early morning readers, because your girl can't see anymore. Eyesight is shot. It is about 7:30 Central Time on Friday. We are a week out from the big announcement. So I know you've seen my YouTube video, and you know recently that I shared a message with everyone about my diagnosis with breast cancer. It is essentially a month now since everything happened, and it's time for another update, right? Today I come to you fresh faced. I have no eyebrows. My hair is wrapped up. I'll talk to you about that a little later. I'm actually in the process of deciding on cutting it and what style I want. I've big chopped, let's see, probably like 3 or 4 times in my life now. So I'm not a stranger to the process. It's just this one is going to be, a little more, I think, emotional. But in short, I start chemotherapy next week, which is why I'm talking about cutting my hair. And that process, unfortunately, is going to take my strands, what few I have left, and my little edges. So yeah, I spent some time with mom last week or this week, cut her hair. I usually do that once every like 3 to 6 months. And I colored it and, just lifted her up with love. Because if y'all don't know, mom is the reason for the season, why I'm here and everything. And we've developed quite a bond over the last, you know, 44 decades plus, right? But especially over the last few years since she's been under my care and our extended family's care. So whole time. Yeah. Anyway, a lot is going on. I've got all of my medication for my chemo. And what I wanted to quickly share was that my chemo is about, originally it was 12, it's going to be 18 weeks. And it's going to be fairly light in the sense that, I don't know if you're familiar with the chemotherapy process, but a lot of people, they need to keep a consistent level of the drugs in your system to fight the cancer. And typically, like you'd hear of folks who have more aggressive types of cancer or treated cancer that's treated differently going in for like 5 days at a time for chemo every day and then 2 days off, right? And doing that for weeks and weeks. Breast cancer is treated a little differently, not as aggressively, although the drugs that they give you to fight the cancer are significant. Chemotherapy is no joke. But in this case, I only have to go once every 2 weeks for infusions, and that's what I call them. I call them my chemo cocktails. And so essentially next Wednesday, April 10, I'm going in for my first infusion or first cycle. I'm going to do 18 weeks, and essentially that amounts to 6 cycles. So 6 times 3, 18, right? One cycle, one infusion per cycle, right? So on Wednesday, I get essentially a full day of chemo. And that's partly because the drugs are pretty powerful and strong, and they need to monitor you closely. They have to administer them slowly. It's not like, you can go in and get a quick IV or a shot. The first infusion for me is going to take between 4 and 6 hours, they said. And then it's all the prep that has to go in beforehand. I have my handy dandy port in. I don't know if you can see it. Oh, right now it's covered over with a bandage. I don't want to freak anybody out, but if you're curious, I mentioned in a post that I have a scar. It's healing nicely. I scar really easily, so don't be alarmed by that. And some of this is also like leftover from the procedure. They put on like a liquid skin on it that's like purple colored. So that's kind of why you see the darkness. And this is my Mederma scar, silicone scar patch. When I tell you these bad boys are game changers, game changers, it has already within a matter of days smoothed out my scar. It protects it. I have a little bit of liquid skin over the scar itself because it's still just a little tender. It's been about a week. And I don't know if you can see that little bump in my skin. That essentially is the port. I have a barred port, slim, low profile, as low as they could get. And don't ask me about Facebook and Meta and all the places that are now sending me these crazy ads and stuff about lawsuits and all that. It will be what it'll be, but I needed to get these treatments. So I got a bar port, power port at that. Anyway, the port allows easy and quick access to my veins. It's safer than putting it into the veins in my arm, which are really thin and small, and it can tend to break down and not hold up. So this ensures that that doesn't happen. It's also something that, only, doctors and trained nurses can use and access. So I'm like, if I ever have to get blood drawn, I can use that port for blood draws, for my chemo, for scans and stuff like that, dyes and things that they have to put in my system to see things on the inside. But only trained professionals. So I'm like, you can't touch my port. Don't touch my port. Anyway, it's early, y'all, and I did not plan on making this video, but I am just talking right now. And speaking of talking, I had my first therapy appointment this week with a practitioner who was so gracious. My primary care got me in because I'm still on the waiting list to meet with like an oncology therapist. And that's someone that is particularly specially trained in therapy for cancer patients or patients that are undergoing chemo, radiation, all the really intensive treatment, because apparently that's a different journey and a different type of skill that practitioners need to walk patients through that experience. But for right now, I'm with a psychologist at University Health, an amazing lady who literally just squeezed me into her schedule on a weekly now. And we had our first meeting. If you know anything about therapy, usually the first session is more of an information gathering, getting to know you. I call it like the speed dating session to see if y'all like each other, if you can vibe. And for me, it's very much a talk space. And I need it. Very much need it. And so, one of the things I will say about this whole process is advocating for yourself means being able to anticipate what you need, sometimes even before you need it. Um, I've been lifted up in so many ways by friends and family who have encouraged me, but at the same time, I know myself. I'm deeply feeling, very intuitive. I consider myself highly organized and type A with things. Like I want to get everything done and done nice, dot all my I's, cross all my T's. But in this case, you can't do everything. Kind of like I liken it to my dissertation process, which I'll talk about later. Um, but you got to do it by bit. And in my case, I was feeling a little like I was walking through a fog and still am. Like a lot of this doesn't seem real. Like I haven't had my chemo yet. I've got all my meds. I'm preparing, but I still physically, aside from this face, don't see a whole lot of change. But I feel it. I feel like I can't cry anymore. Like I got no more tears. These little tear ducts are dry. Um, so I wanted to talk to someone in short to kind of shore me up for what may be, some sort of like wall that I hit. Um, where it all comes flooding back. And I want to make sure I'm prepared, especially for my mom. Um, for those who don't know anything about mom and her background, she suffered a major disability at 13. And since then, you can kind of liken her to being on a spectrum, if you will, an autism spectrum in terms of her cognitive ability and reasoning. She's super bright. My mom is probably one of the smartest, funniest ladies I know. But her disability is such that her short-term memory is really, not the greatest. And so, in short, when I told her about my initial diagnosis, we had a moment and she handled it really, really well. I went back this week and I forgot. I literally just forgot that I need to remind her of things. And so I started talking about my chemo and she forgot and she got really emotional and she started crying. And I'm not, trying to put my mom's business out there in any way because we tend to kind of protect each other and we don't talk about a lot of this stuff, but I think it's important to share because I had to pause for a moment and remind myself that it's more than just me that's on this journey in terms of my healing and my the people that care and a lot of the fear and anxiety that comes along with that. And when I say, connecting that to therapy, being able to show up for myself for the times when I'm not as strong means also being able to show up for my mom as well. So in short, she thought I was gonna die. She thought that, she didn't remember about the diagnosis that I told her about. So I had to remind her all over again, what it was. And the fact that, we come from a family of survivors. We have, sadly, a number of female relatives, including my grandmother and my aunt, who are all breast cancer survivors, right? We have two cousins here in Kansas City who are going through the journey or have gone through that journey as well. So I had to remind her, like, look, no one in our family died of breast cancer. We all caught it at a great time, at a good time, got the treatment, and for the most part are living like healthy, rich, happy lives, right? And she seemed to be okay with that. But in short, it took her a minute. And so, ironically, I'm wearing this turban. She gave it to me before I left, and it's my favorite color. So, for those who don't know, purple, all shades of royal purple, and bluish indigo purple, are my faves. They inspire me. They make me feel good, feel pretty. um, so anyway, we had some time together, and I'm grateful for that. I'm gonna go check in on her again today. But this week before chemo, it's been a week of shoring myself up and getting ready for what's to come. And therapy was helpful in processing a bit of that. I look forward to our next session, which hopefully will be a little bit more in depth, and we'll get to some of the, meat of what I'm feeling and why I'm feeling, and the resources, supports that I feel like I need to connect with. But that's not why I'm here. I am here to just tell you about what is. I'm here to talk and to give you an update and positive news, right? Since my last update, I've had two more biopsies and an MRI. All three revealed no spread. So that's the good news. So I have, at this point, what they can see is that the cancer is contained in my tumor that's grown, but not significantly. And I am officially grade 3, which again is on the higher end of the spectrum for growth and potential to spread, but it hasn't yet. And a still staging, I have to follow up with my oncologist to confirm, but I think I'm still hovering between a stage 2 and 3, depending on the size, but not spread, right? Which are factors that they determine to say, okay, are you at the next stage? Um, so anyway, then chemo, which I started to talk about, and that's 18 weeks, 6 cycles, once a week, and then a 2-week resting period, and then I get it's 1 day of infusion, and then I go back and get a shot or a shorter injection to build me up. What I'm learning about this chemotherapy process is that, you know, like most cancer treatments, it's harsh. It's kind of the gold standard from what I was told in terms of what I'm getting, but it's going to, kill good cells as well as bad cells sometimes, right? And so hair loss is part of that. I have to watch out for neuropathy or numbness and nerve damage in my hands and extremities. And then essentially too, I might have to get rid of these beauties. Put them on a couple weeks ago to make myself feel pretty. They're like tips with like an acrylic gel dip powder, and then a sparkly kind of unicorn top. Anyway, more than likely these are going to have to go just because they want to look at my nail bed and be able to see if anything starts to happen, like, discoloration and then lifting of your nails. Sometimes that can happen. You might lose some. Um, I liken it to being an athlete in many ways, except you're not, working up a sweat every day. Well, you are, just differently for different reasons. Um, I remember I used to run so hard and so consistently that I lost a couple toenails because of the friction when I would have to wrap my toes, and I felt like a dancer. That's what I thought ballerinas had to go through. Um, but dancing on trails, And in this case, I'm dancing for my life at this point. This chemo is going to put me through a whole marathon, and I'd like to say that I'm ready. I don't know if I am fully. I don't know if I ever will be. But this I know for sure. I'm gonna do it. I'm gonna get through it, just like countless others have. So I am trying to sit in a place of gratitude and realism, being gentle with myself. So I'm not an early riser, but today I'm up early and I'm leaning into it all the way. It's a sunny day. I got some music playing in the background. I got my little turban on, washed my skin, did my prep, um, lined up all my medication. Because again, with chemo, a lot of it is treating symptoms, right, of the effects of chemo, right? So the infusion that you get of the chemotherapy drug is only a part of that. The rest of it really is nausea, dry skin, sinuses, pain management, um, and the majority of the medicines that I have are to treat that, right? And then checking in regularly with my providers to make sure that they're addressing any symptoms. And if need be, they adjust my cocktail, right? But all of this for me feels very theoretical, feels very right up here. I won't know for sure what all that is until I'm in it. And I just pray that I have the fortitude. And again, I'm trying to sit in a place of gratitude and realism about the process, realize that I'm showing up not just for myself, but for everyone. And so I think I'm going to wrap this up with a thank you to everyone who supported me at this point or to this point. I started a GoFundMe campaign, and originally I was reticent to do it, but the reality is I am a full-time grad student and I was working part-time because I was at the tail end of my dissertation, which meant that I wasn't out consulting and doing my usual hustle to bring in extra income so I could, do what I typically do, which is not necessarily have to worry about where my funding is coming from or next meal or my expenses. And I knew that had to change. And so I needed to shore myself up. And so I talked to some dear friends who agreed to help manage my GoFundMe. So right now I have one. I'll drop a link if you'd like to give. But I really just wanted to say thank you to everyone who's given so far. I believe as of today, I have met about 30% of my goal. And I just posted my GoFundMe a week ago. So, not to make that the primary focus, the reality is it's just what it represents, which is your love in action via bell hooks. Like, she helps us to appreciate that love is a verb and it requires doing as well as feeling and thinking, right? And y'all have shown up. Y'all are doing it for me, little old me. Thank you, thank you, thank you, thank you, thank you. 30% in less than a week has been, or about a week has been amazing. And so I count myself blessed and highly favored and relieved because with the funding to date, I've been able to do a number of things: pay off my insurance, out of pocket expense, up to for the next year, right? I'm covered fully. Essentially, I don't have to pay anything more. My prescriptions, for all the over the counter drugs and prescription meds. I was able to get my car serviced in advance, did a vehicle check the other day to make sure nothing was crazy going on so that it would be fine to get me back and forth to treatment. And then what else did I do? Ah, a month of monthly expenses are covered in the bank. It's just waiting if I need it. And so I can't thank you enough from the bottom of my heart. It means everything. And so I've been trying my best to follow up with you. If I have not reached out to you, please know that I will as soon as I can. It's not personal. There are a few people that are at the top of my list who reached out to call right away. And as much as I wanted to answer the phone, literally was in the middle of appointments and scheduling and life stuff. So please charge it to my head and not my heart in circumstance. And I look forward to checking in with you all soon. Please keep the love coming. I love you. I love you. Love you. And I'll get back to you with another update. Maybe next time I'll have a 20-inch bust down wig. And I'll have a fresh face of, makeup and lashes and stuff. Love you. And check in again soon. Bye.
Girl. Okay. I got myself a 20-inch bust down. Listen, I don't know what to do, but this is HD. Place. It's giving. It's giving a lot of hair. Y'all, help me out on this journey. It's not bad.